Spine Institute. Our patient has traveled from Ohio. She's a nurse. Unfortunately, she's had fusion done already on her spine. As a result of that fusion, she's had so many problems, including adjacent segment disease. Now she has pain above and below her fusion again. She already had adjacent segment disease. She had one fusion. She needed another one. There's a lot of dead muscle scar tissue back there, but she also has a spinal cord stimulator. None of that's working to eliminate her back pain. She's did a consultation with Deuk Spine Institute virtually on Zoom, and we discovered that she had 7 sources of her back pain, and we're fixing all 7 today. So she can get back to having a productive life, hopefully pain-free immediately. Now, this last issue we're treating is called piriformis syndrome. And Henry, let's show the audience what causes piriformis muscle pain.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes, minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. We've just finished her left piriformis release. It went really perfect. I could feel so much scar tissue where the muscle had been torn. I was releasing all that scar tissue. It's really called a myotomy, which is a cutting of the muscle, but it's really a release off of the top of the hip. And this is a patented procedure I discovered, pioneered myself. I got tired of patients coming back after having piriformis surgery and shots from other doctors, and they still had the same pain. And they had horrible results with the surgeries on their piriformis. So I decided I was going to cure this problem once and for all. I studied the anatomy book some more and figured out the perfect spot to release the piriformis muscle, where we couldn't do any damage to muscles or nerves or blood vessels. And when I say muscles, I mean the other muscles. Obviously, we're releasing the piriformis, but we want to leave the other muscles alone. Are we rotated?
Yes, sir.
So we pioneered and patented this procedure, and we've done it about 200 patients, and we've had a 100% success rate of curing the pain. Sometimes we had to bring the patient back and do it a second time. That was early on when we were first starting, but now we pretty much have had 100% pain relief in the piriformis for the last 6 months. Any questions?
Yes, we have about a few questions. This next one is coming from Hookem1963 on YouTube.
Nice. And have we shown the video on piriformis?
Yes, we have.
Yet? All right. Go ahead. I'll take Hookem's question. Welcome, Hookem. Thanks for joining us.
Asking, can you do a lumbar facet rhizotomy and a lumbar disc repair in the same procedure? How do you reach the posterior aspect of the disc with a lateral approach?
Yeah, great question. So can we do a DLDR, fix a disc problem at the same time as we do a facet? The answer is yes. We just did it in this patient. She had both. We actually made it 2 separate streams, but she had both done. The way we get into the disc is through the foramen. So I come from the side, and I basically get into the foramen, transforaminal. I use an endoscope, and I can see the tear, and I can get in there with the laser and clean the tear, do a debridement. That's really what we're doing, is a debridement. And then we just make a separate incision over the facet joint and do the rhizotomy. So we just did that for her. If you go back and watch the videos, you'll see both. All right, we're pretty much done here. She didn't have as much scar tissue on the right, which is weird because the right side hurt her more. So it was not as scarred up as the left side. So it's a bit odd, but hey, it's done. I'm happy with the results.
Sitting down, please. Thank you.
Any other questions?
Yes. This next question is coming from Southern Skies Farms on YouTube.
By the way, this is the incision right here. You guys see it? For the piriformis. It's tiny. Go ahead, Luis.
Yes, we
4
do.
millimeters. 4 millimeters. Tiny. There's very little bleeding, but this is the most painful surgery I do, by the way. The patients will complain for a couple of weeks afterwards about pain in the back of the hip, right where we go in and do the surgery. Probably due to blood irritating the muscle a little bit. But basically we're done with her. We did everything. We did a DLDR here. We did the facets here. We did the SI here. We did the 2 piriformises. So, and you can't even see the incisions. 3 months from now, they'll be invisible. I'll take the questions as we finish up.
Lastly, from Southern Sky Farms on YouTube, asking, I love all the testimonials on your YouTube channel.
Thank you.
So impressive, though I wish you had follow-up interviews 1 and 2 years after surgery. Do you think you can start doing that?
Yeah, it's a great question, Southern Farms. First of all, I want to thank Henry for those testimonials. He's done a lot of them. The problem is the patients, when they go to the doctor, they get fixed, you don't hear from them anymore. They're gone. The ones that still have some issues that not related to my surgery, but other areas that are bothering them, they'll call me and they'll come back and have more surgeries. But the ones that we fix, they're fixed. And I'm not going to call these people and bother them, in their life and just say, hey, I know you're trying to play golf, but can you do a testimonial for me? Or, hey, I know you're trying to go back to work and do stuff, but can you do a testimonial? It's just not right. I mean, how many doctors have testimonials, period? And there's nothing, the next day after surgery, there's no anesthesia they have. There's no medicine that lasts to the next day. So you're seeing them 24 hours after surgery. They're taking 0 pain medication, no narcotics. If you go have a discectomy or stimulator or any type of other spine surgery, you're on narcotics. You're taking pain pills. Our patients take 0 narcotics from us. They take no medicine whatsoever. Half of them take 0, the other half take a Tylenol the night of surgery. That's it. So there's no medicine, there's no anesthesia. What do you think is the day after surgery versus a year after surgery? There's no difference, all right? If my patients had pain a year after surgery and they all had to come back and have the surgery done again, do you think we'd still be in business? We wouldn't, all right? We do hundreds and hundreds of these a year, and our patients don't come back. All right, they don't come back. So there's lots of evidence to say it works. We have people who will watch and they'll comment, I had surgery last year. But I can't track these people down and ask them to do a testimonial. It just isn't right. And these people pay for their surgery out of pocket. So they don't want to be bothered and harassed. They're gracious enough to do a testimonial while they're here, but I'm not, flying them back from Ohio to do another testimonial a year later. It's pretty ridiculous. Show me just one other surgeon who has curative procedures. Show me one testimonial. They don't exist. All right, thanks for joining us. We are done. Our patient will go back to Ohio tomorrow. Have a nice day. We'll be back for one more procedure. We're going to be treating a patient from California. She has an arthritis in her thumb. It's all full of arthritis, but she's having horrible pain, can't use her hand. We did the same thing to her right thumb last year, and she's pain-free. She couldn't move her right thumb. Now she can move her thumb. She has no pain. Her left thumb is bothering her. We're going to fix her left thumb the same way. Okay, so here's a patient from a year ago. She's coming back for a second surgery on the opposite side. So there's your testimonial. I'm here with a patient who underwent the Deuk PIRIFORMIS release. This is a minimally invasive procedure to treat the third most common cause of chronic back pain, which turns out to be a torn buttock muscle. This is a muscle below your gluteus maximus, deep inside, and it's called the piriformis muscle. It turns out this muscle is really short and very easy to tear. Once it's torn, it just never heals, and then you just keep aggravating it with activities. And what was life like for you with this piriformis syndrome before your surgery?
Not good. Pickleball was affected, just want to say that. So that was kind of the deciding factor. And this was after trying dry needling, PT, you name it. I've done it.
Why did you come to Deuk Spine Institute to get your back?
Because I had you 6 years ago.
Tell us about that.
Had back issues, a lumbar. I have spondylolisthesis, degenerative disc disease, stenosis. It looks bad on pictures. I had really 4 neurosurgeons recommending anywhere between a 3 and 4 level fusion. And I still did not buy it. I went a year and a half just researching. And I don't even know if you know this. I literally stalked you for 6 months on Facebook and asked you so many questions until I felt comfortable. And that's how we got here.
And are you glad that you came to Deuk Spine 6 years ago to get your back fixed?
Oh my goodness. My husband can probably give a better testimony than I can because he had to watch the pain that I was in. So
he suffered too, but you were pretty desperate 6 years ago. Life was pretty dark for you at that time, wasn't it?
Very dark.
And there are a lot of people out there who are in that same boat right now. What would you say to those people?
Oh, don't wait. I waited a year and a half. That was longer than I should have.
And you were on the verge of giving up.
Yep. The surgery is not paid for by insurance. Tried to run it through Blue Cross. They would not. It can be expensive. But looking back in the life that I've had since then, you can't put a number on it.
No, you can't.
And even now, I really waited too long. I've had this for a while, thought I could fix it on my own. And I'm not kidding you, that pain from the surgery is nothing compared to the piriformis pain. And I should have done it a long time ago, waited too long.
So you came back to Deuk Spine Institute from Phoenix, Arizona, right? You had your piriformis release done at Deuk Spine.
Yep.
How do you feel after your piriformis?
Oh my goodness. I mean, like night and day. I can't wait to ride. I have not sat stationary in one spot, and I can't even tell you. I constantly am adjusting my weight.
Because of the pain in the buttock?
Yeah.
And is it still there, that pain?
No.
Gone.
Completely.
That's right. Because the Deuk piriformis release is the best treatment in the world, the safest treatment, and the most effective. It lasts a lifetime. Once we do it, it takes literally 15 minutes to do the procedure under twilight sedation. And you had it done. There's a little bruising, but that's it.
Yep.
And now you're back with no restrictions, and you're going to have a normal life. All right. Anything else you want to share with your fans out there?
He's the guy. Seriously, he's the guy.
Well, it's great to see you. Safe travels back
Thank you.
home, and thanks for sharing your story. Yeah.
Thanks.
I get it.